We still have another minute.
Yeah. But like I said, I'm so excited for you guys to come up and hang out and literally it'll be awesome. I'm excited because literally I hate staying in hotels. So when I got the chance to invite you guys to my place, absolutely. It gives you guys a spot to stay that's not a hotel. It's not as personal, and I'd rather stay at someone's house all the time than that's why I like renting houses than literally like Airbnb-ing it than doing anything else. So
Oh, I love Heather and I have done the Airbnb thing too a couple of times. So it is time to get started. Happy Tuesday,
awesome.
everybody.
Perfect.
Listen, I get pretty excited about every speaker that gets to be on the webinar series, but this one in particular is very special to me. I would like y'all to meet my BFF from Wisconsin, the Dr. Chris Anderson. Y'all, I just love him so much. And we are just sitting here talking about the countdown to the days when I get to come and visit him because this pandemic has kept us apart for far too long. So I am so excited to have him here as a first time guest on the webinar series because basically he's like the busiest person I've ever met in my life. We've only been trying to get it worked out with his schedule for the last 18 months. And today was the day the stars aligned and it worked out, which is a real treat for you. He is one of our most requested speakers on the road. You only have to hear him once and you will love him. So if you are looking for an amazing dynamic speaker for your state, y'all know how to reach me. Just let me know and I will help to negotiate this and we will work it into his schedule because he is fabulous. So, ladies and gentlemen, the least boring HIPAA seminar, webinar, whatever you have ever attended in your life with Dr. Chris Anderson.
Well, thank you, love. I greatly appreciate it. Ladies and gentlemen, I am so excited to be joining you today. I am up in our Boston Clinic location here in Wisconsin. And today I have the honor and privilege of talking to you guys about a little bit of HIPAA. Today, we're going to talk about what would you do, HIPAA scenarios in a chiropractic office. So that's my fancy dancy picture. My name is Chris Anderson. I have the honor and privilege of being our clinic director. We have 2 convenient locations in Wisconsin. I also serve as the compliance officer for Ogden Chiropractic and for DeWitt Chiropractic and the OC Medical Group. I also get to help our state association, the Wisconsin Chiropractic Association, and get to help our help desk as well. So I'm very honored and I'm so excited that I get to be joining you guys today. So I would like to start out with a little bit of fun. So knock, knock. Who's there? HIPAA. HIPAA who? Sorry, I can't tell you that. So let's talk about HIPAA. We're going to talk about a little bit of a review to start off with. We're going to go then jump into scenarios, do a little definitions in there as well. And let me just tell you, we're going to make this fun. And again, if you have any questions, comments, concerns, we're all in this together. So chiropractic, we're a family. The more we all work and grow together, it just doesn't make your practice more successful. It grows our profession, and really that's what it's all about. So HIPAA stands for the Health Insurance Portability and Accountability Act. We're going to talk about some basic terminology and go from there. So what is a covered entity? A covered entity are groups or individuals who have to comply with the law. These include offices like ours, clearinghouses, healthcare plans, insurance companies, and providers who conduct electronic transactions relating to third-party billing. Protected health information. Hey, everyone loves protected health information. It was created or received by a covered entity, relates to past, present, or future healthcare, health, or payment for healthcare related individuals. It identifies individual or directly or indirectly, and can be, don't worry, I get questions all the time. Well, I'm all electronic, or can protected health information, is it done if it's orally or if it's just if it's written down? No, it's all 3 of the above. If it's on paper, electronic, or if it's done orally. Examples include charts, billing records, EOBs, round lists, hallway conversations, databases. Pretty much, you just can't talk about it. So some of the identifiers, we're going to talk a lot about these soon, but they even include things like IP addresses, account numbers, beneficiary numbers, fax numbers, so on and so forth. So therefore, we're going to go more into these in a little bit, but literally, there are so many identifiers. You just have to be careful. So again, when you're training your team members, because again, this is not an office. You don't have staff members. You have team members. We all strive together to work as a team in order to go ahead and comply to these rules and regulations. So when you're working with your team, make sure that you work with your team, that they are able to understand, and you have your meetings in order to understand what these are so they can create policies and procedures, and you can work things out that you can understand what's going on so they know what's going on in that regard as well. So now let's talk about use and disclosure. So use takes place within an organization holding of what the medical information. So it's what we use, okay? Whereas a disclosure are releases to parties external to the organization. So it's what we share. So use is what we do inside, where disclosure is what happens outside in that regard. So role-based access. So covered entities must identify which persons in the organization need access to PHI in order to fulfill their duties. So this happens in your software where you need to create role-based access. So let's say your biller needs access to everything. However, does your front desk team really need to have access to everything? You need to create policies and procedures that we've talked about regarding its compliance, whether it's HIPAA. You need to make sure you have policies and procedures in place in order to make sure that it's a need to know, and you need to have a quality control in that regard. Minimum necessary. This is one of my favorites. So covered entities must limit the PHI use or disclose to the minimum necessary to achieve the purpose or the use or disclosure. So it does not apply to treatment, disclosures to payment themselves, disclosures to authorized patients, or to certain situations required by law. So again, it's minimally necessary. So what is the minimum necessary that you have to do in order to, information you have to obtain to do your job? So does your front desk team, do they need to go through all the notes and see that Mrs. Smith, came in and she herniated her disc because they were nosy and wanting to know what's going on? No, absolutely not. They don't need to know, and you dig into that information, and you need to have standards to make sure they understand what is necessary and what's not necessary, and making sure that there is minimums that you set that they need to go ahead and acquire in that regard. So I find your lack of compliance with HIPAA disturbing. So let's go into a little bit more. Again, HIPAA was created, was revised in 1996, and there's a couple of divisions we're going to talk about briefly. I'm just going to summarize this with you. There are lots of speakers that talk about HIPAA, and this is just one that Ms. Christie asked me to touch on, so that's why we're doing it. So we're going to talk about 3 privacy rules next. Then we're going to jump a little bit more describing these, and then we're going to get into our scenarios. So let's talk about it. We're going to talk about the privacy rule. We're going to talk about the security rule, the electronic data exchange. And again, these are all in part of HIPAA, and it's just 3 little divisions in that regard. So the privacy rule. The privacy rule went into effect in April 14th in 2003. Privacy refers to protection of an individual's healthcare data, defines how patient information is used and disclosed, gives patients privacy rights and more control over their own health information, outlines ways to safeguard protected health information. Now, keep in mind that some states might have more stringent rules. So if you're in a state that has more stringent rules, you have to follow those more stringent rules. So again, some privacy laws are more stringent than the HIPAA privacy rule. So whatever law is more stringent is the one you need to follow in that regard. The security rule regulations went into effect in April 21st, 2005. Security means controlling confidentiality of electronic protected health information, storage of it, and access. So keep in mind, part of the security rule is not just how you keep it confidential, but also how do you store it? So how do you guys have your backups? Do you access your backups? Are you working with your IT people? There's lots of stuff that go into it. And again, this is just a brief summary. And so if some of this is a little bit foreign to you, please reach out to Ms. Christie. She'll get you my contact information, and I'd be more than happy to try to help and point you in the right direction. Because again, we're a chiropractic family. The more that we grow and achieve success together, it grows not just our individual practices, but strives to make our profession even better than what it is. So the electronic data exchange defines a transfer of format electronic information between providers and payers to carry out financial or administrative activities to the related healthcare. Information includes coding, billing, and insurance verification, and the goal of using the same format is ultimately to make the billing process more efficient. So therefore, when you're sending your electronic claims, I know we use a clearinghouse. So in our clinic system up here in Wisconsin, we use our clearinghouse and we make sure that it's encrypted to make sure that we are following all policies and procedures to protect our patients' data to the extent of our capability. And by the way, I do apologize if you hear a little bit of a twang. I have family that lives down in Mississippi. And every time I talk to Christy, who's a dear friend of mine, sometimes that Southern twang comes out. So I apologize in that regard. So, and a big prayer is heading for everyone down on the coast of Mississippi with that hurricane brewing. So, jumping right back to HIPAA. So why comply with HIPAA? We comply with HIPAA to show our commitment to protecting privacy. As an employee, you're obligated to comply with insert your name, your office. Ours is Anderson Chiropractic Clinics, privacy and security policies and procedures. Our patients and members are placing their trust in us to preserve their privacy and the most sensitive and personal information. And isn't that the truth? When a patient comes into us, they're coming into us and they say, hey, doc, my back is killing me. I'm dying. And literally, what a great compliment it is that they put their trust and confidence in us in order to get them better. Well, we need to go ahead and do something in that regard as well. And that we have to preserve their privacy to the most of our capability. Compliance is not an option, it's required. If you choose not to follow it, if you choose not to follow the rules, there's ramifications in that regard. You can put yourself at risk, including your personal penalties and sanctions, and you can also put your clinic at risk, including your financial, your licensing, and even your reputation. So, HIPAA regulations require that we protect our patients' PHI in all media, including but not limited to PHI that is stored, created, or transmitted in the following media. Verbal discussions, personal information on the phone. Can you go ahead and just pick up the phone and start talking about anything? No. Like in our clinic, if we're talking about a patient up at the front desk, we use our patient identifying numbers. So if Mario Mario is here. Hey, Mario. We don't talk about Mario. We refer to him as a patient number. By the way, Mario is one of my mentors, so I love him to death. So again, you need to have standardization set up. So therefore you can protect that HIPAA information to the utmost degree. Written on paper. If you have patient charts or progress notes or encounter forms or x-ray orders or referral forms or EOBs or whatever it is, some of our offices are pretty small. So your front desk team member might also be the one regulating and doing your EOBs and processing it. So she might be working on that in between patient encounters. We'll make sure you flip it upside down. Our big thing is that when I look at your desk, I should not be able to see anything. So we flip everything upside down, and that's part of our policies and procedures. So if anything's written, we can protect that as well. Computer applications and systems, electronic healthcare records, practice management systems, x-ray, so on and so forth. It's all digital now. So we have to make sure that what we're doing is we're following all policies and procedures to make sure. So when I leave a room, I hit Control L on my computer to lock the screen to make sure that literally no one sees my screen. If a patient is brought in early or if I'm running a little bit behind, that way that they can't access anything on that. And it's just a checks and balances system. Keep in mind as well as how many of us, when we're rescheduling patients to go up to our front desk team members, and they're trying to look over the screen to kind of see what's going on in that regard, because they want to know who else is on the screen. So do you have those privacy protectors that you have on your screens as well? That's a really simple thing. You can order them on Amazon. By the way, if Amazon wants to sponsor me to speak, by all means, I'll be sponsored by Jeff and the Amazon team. So the computer hardware equipment. your PCs, your laptops, your PDAs, your iPads, stuff like that. Do you have special equipment on there to protect our patients' integrity and their PHI information? That includes passwords, so on and so forth. Just to let you know, 0000 is not a password. You need to have something a little more secure. You know, on our cell phones and a lot of stuff, they have facial recognition. So therefore, that's a really easy way that you can go ahead and utilize that and make sure you have those standards already outlined. So your medical records are safe with us. I wouldn't trust a place like this, especially if they have someone on a cot. But again, we need to uphold it to the best of our ability. So why is privacy and security training so important? It outlines ways to prevent accidental and intentional misuse of PHI. It makes PHI more secure with minimal impact to staff and business processes. It's not just about HIPAA. It's about doing the right thing and make sure, and perfect. There's no such thing as being perfect. We can go ahead and we can practice to the best of our abilities and do our good faith effort to make sure we're doing it at the best of our ability. And where does that come from? Training. And that's why you're all joining me today. And I'm very excited. That's why we're all here. And again, it's learning and trying to achieve. If you're not doing any of this right now, please reach out to us. We're more than happy to try to point you in the right direction to make sure that you are. And if you're not doing the right thing right now, we'll start doing it today and move forward in that direction. It shows our commitment to managing electronic protected health information with the same care and respect as we respect our own private information. So why is this, again, why is it so important? It's everyone's responsibility to take confidentiality of patient information seriously. Anytime you come in contact with a patient information or any PHI that is written, spoken, electronically stored, you become involved with some facet of the privacy security regulation. So if you're walking by and you're like, oh, you see a team member that's not complying or might be, overstressed or something, help them out, flip it out, try to help them, and then try to help them grow in that regard. The law requires us to train you. Okay, your doctors, the doctors out there, please train your team members. And if you need help, please reach out to us. There's lots of resources. Miss Christie has a bazillion resources. She is the most well-connected person I know, and I'm very honored that I get to call her a friend. But she will go ahead and help you get the help that you need in that regard. And you also must train because you have to make sure that everyone understands the privacy and security rules as they relate to their job role. So therefore, it's all part of that training. And again, it's a mesh and blending of how things really relate in that regard. So again, remember when I talked to you guys about PHI before? Well, again, PHI is protected health information that is individually identified, created or received by healthcare providers, healthcare plans, employers, or healthcare clearinghouses that relate to past, present, future physical or mental health or conditions of an individual. Relates to the provisions of healthcare to an individual, to the past, present, or future payment of that provision of that healthcare to the individual. So in other words, it's pretty much relates to everything past, present, and future of what's going on with that patient. So PHI includes encounter or visit dates, appointment dates or times, invoices, radiographic imaging, history and report, physicals, DOTs. I just got certified to do medical DOTs, so I'm excited about that. And it also includes that, and we have to have policies and procedures in order to keep that information secure as well, and other patient identifiers. So PHI includes information by which the identity of the patient can be determined with reasonable accuracy and speed, either directly or by reference to other publicly available information. Speaking of that, have anyone ever Googled yourself? I just recently Googled myself. There is tons of my personal information out on the internet. It's crazy. So therefore, if you can go ahead and listen to a conversation and you can have a good guess on who that is, again, that's why you need to really be working with your team members on how you try to protect patients' information, both inside and outside your clinic system. So these are some of the examples of patient identifiers: their name, their medical record numbers, account numbers, vehicle numbers, social security numbers, license plate, health plan, even your image of your face and some softwares, we get that in there as well. That's all protected as well. Any dates related to the individual, your dates of birth, your phone number, your cell phone number, your email address, literally even your IP from your computer is protected information. So again, remember when we talked about this before? So again, use is when we review it internally, such as audits, training, customer service, quality improvements, or how we use it in the office. And disclosure is when we send it outside the office. So like, how do we disclose information to an attorney? How do we disclose information to a patient, or we're faxing records or emailing records or put them on a thumb drive? You need to have policies and procedures in place and great training in your clinic system of how you use and how you disclose information in that regard. So what's, again, we talked about minimally necessary, but again, we need to identify what is the minimum need to know basis. So if we get a request for information, what is the minimum that a person, a team member, needs to access in order to get that information out? So it's a need to know basis. So do they need to go through all the charts? No. But again, it's setting those standards and setting that with your software, working with your IT person as well as your compliance consultant or compliance officer to make sure that that's all being done in the proper way. So again, so you heard this before: treatment, payment, healthcare operations. So HIPAA allows us to use and disclose PHI for the purpose of 3 reasons. And again, use and disclosure we already talked about. So again, these 3 reasons are treatment, payment, and healthcare operations. So treatment is providing care to the patients, whether it's utilizing our equipment or it's utilizing our rehab department. We have a PT in our office, and she's fantastic. So again, when I'm talking about a patient, I try not to use very much descriptive information. I try to use, if I'm talking about Christy, I might say, yep, I saw Miss Christy. She's doing a lot better. She has a little bit of left hip pain. And I'm talking to the physical therapist in that regard. Again, it's all internal. It's all for treatment. We try, again, to use only first names. And again, if we're by anyone else, we try to go to a private room to talk about it. If not, we talk in code. Patient 1, 2, 3, 9er. And then we talk about that patient so we kind of know what's going on. Payment, the provision of benefits and premium payment. So it's payment regarding from your insurance, so on and so forth. Healthcare operations, normal business activities, reporting, quality improvement, training, auditing, customer service, resolution of grievances, data collection, and eligibility and accreditation in that regard. So why do we need to protect PHI? It's the law. To protect our reputation, to avoid potential withholding of federal Medicaid or Medicare funds, and to build trust between providers and patients. So the federal government protects PHI through HIPAA regulations. Civil penalties, woofta, $1.5 million a year for identified purposes of violations. Criminal penalties go up to $50,000 per fine and 1 year in prison, $100,000 fine and 5 years in prison for obtaining disclosing through false pretenses, and $250,000 fine and 10 years for obtaining disclosing for commercial advantage, personal gain, or for harm. Your clinic needs to go ahead and make sure you protect yourself. So how do you do it? Through your notice of privacies and practices. So therefore, when you go to an office or you go to the hospital or wherever, they give you a copy of your notice of privacies and practices, and you should have that all filled out, and you should have your policy and procedures so that your clinic make sure you follow that and you let your patients know what's going on in that regard. So how are the regulations enforced? The public is educated about the privacy rights and will not tolerate violations. They take out action. The Office of Civil Rights, the OCR, the agency that enforces the privacy regulations, providing guidance and monitoring compliance, and the Department of Justice, the agency involved in criminal privacy violations. They provide all the fines, the penalties, and the imprisonment of the offenders. So HIPAA guarantees private patient rights that they received a notice of private practices from their provider, access and inspection of the copy of their medical records, request for corrections to their medical records, request special accommodation to how their information is communicated, They have the right to request restrictions on how their information is used and to receive an accounting of non-routine disclosures. So do you know that anytime you use that information, your computer tracks who accesses that information and when? And you should have checks and balances that are established in order to understand when you should use it and how you should use it in that regard. So let's talk about some of the security rules. So basic requirements for computer security are, again, you locate computer systems containing PHI. You install firewalls for data integrity. You encrypt internet transmissions of PHI. You maintain password protections, and you limit the access to patient files based upon job duties. So basic requirements for clinical uses. You designate a privacy official. You develop policies and procedures. You train all your team members. You establish a complaint mechanism, and you enforce sanctions, civil and criminal penalties in that regard. So now we talked about all the boring stuff. Now we get to talk about more of the fun stuff and regarding some of these scenarios. So scenario number one. So these scenarios would actually work great in a staff training. And since this is recorded, you could use this as a staff training situation for your team to review and then pause it and talk about what they would do. That's what we do in our clinic system. And then we review the answer. So number one, I was just concerned. Your coworker, Joan, hasn't been at work the last 3 days, and you're starting to get worried about her. You consider her a friend and conclude that she'd be hurt if you didn't call on her. You don't have her phone number, but you know it's in the electronic medical record. So you log on and look up Joan's phone number. Is this okay? Actually, it's not. It's a violation of HIPAA. If Joan didn't personally give you that information, then you can't access it in the electronic medical records. Same thing. I'm from a small town. I'm from a town of 10,000 people. In that town, everyone knows each other. I had a friend of mine that was supposed to come over for dinner, him and his wife, and literally and I was expecting a phone call from him. Well, he changed his cell phone number and he said that, well, I just thought you'd have the new information because I gave it to your team. Absolutely not. You have to wait for them to personally give you that number in order to do it. So, because consider this, while looking up your phone number of your friend, you notice they have a diagnosis of breast cancer or something else like that. See, it's a slippery slope and we don't want to go there at all. So scenario number two. An 18-year-old high school senior at HIPAA High School gets injured at gym class. She's having lower back pain, and her best friend, who is a current patient, takes her to your clinic. A few days later, her mother reads a text about her lower back pain on her phone and angrily calls your clinic demanding more information. The front desk team member confirms that her daughter visited the office for a sprain of the lower back. Is this a violation or not? I wish I had that music, like do, 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 do. Okay, we'll keep going. So the answer is actually this is a violation. So make sure that you review your company's policies and procedures. The team member violated HIPAA and could be fired. Because the girl's 18, the mother does not have any legal right to her medical information unless the daughter has signed a consent form giving the mother the rights, which seems very unlikely in this case. Also check with your state laws in this regard. This did happen in some format in our clinic, and we actually had to terminate the team member in that regard. Number three, I just needed a gallon of milk. So you're a chiropractic technician, a team member, and this morning you were at the clinic and you were with the doc and you guys saw a 6-year-old Allison for a rapid strep test. And again, rapid strep test can be done sometimes, but check with your state law, depending on if it's in scope and practice or not. And on the way home from work, you stopped at your local grocery store. Ours is Viking Village Foods for a few things. Walking through the frozen foods, you run into Allison's mom, Sherry. I'm glad I ran into you. Did you get the strep results? It would be great if I knew so I could call her primary at Reedsburg Area Medical Center and get her in this afternoon and back to school as soon as possible. Can you disclose this information to Allison's mom? Nope, you guys were right. Absolutely not. You cannot disclose the information. We teach our team members, please go ahead and contact the clinic. Check with your state laws again to see if it's within scope of practice. But again, I repeat, a phrase that Mario taught me a long time ago is I cannot confirm nor deny due to patient confidentiality. I repeat, I cannot confirm nor deny due to patient confidentiality. And that's what you should teach your team members as well as yourself as well, and encourage them to contact the clinic for more information. Number 4, Mr. Alberson is on the phone. He states his wife was in the clinic yesterday for a radiographic imaging and wants you to tell him the results of it immediately. He is very, very angry. I have the right to know since I pay the bills. Your front desk team brings up the report and shares it with him. Is this a violation? Well, no, this really is a violation. Your team violated HIPAA unless the woman has signed a consent form giving her husband access to information, medical information, which many women do. So do a lot of guys. Otherwise, the team member would only be authorized to tell the woman herself the information. Do not tell, not to tell it to her husband or even leave it on the answer machine. You have to be very careful of how you leave that information. Unless authorization has been given, you can't discuss the situation. Again, I repeat, I cannot confirm nor deny due to patient confidentiality or due to HIPAA privacy. Number 5, 2 chiropractic team members who work at ChiroHealthUSA chiropractic clinics are shopping together at their local Walmart after work. As they're walking around, they talk about their patient, Barbara. She was in the clinic today for treatment. They discussed how her back pain is due to her being extremely overweight and how her house is on Main Street is just a dump and she doesn't take care of it. Do you think this is a violation of HIPAA? Absolutely. And the team members did violate Barbara's right because they spoke about her in public and used identifying information, her name, that she lived on Main Street, and they even discussed her case. And yes, there's a picture of a goat. I was in Wisconsin Dells, and literally somebody brought their pet goat with them in Walmart. And I'm sure we all have our Walmart stories, but this is the picture I took, and I couldn't help but sharing it with you that yes, even here in Wisconsin, people carry their pet goats in with them to Walmart, which I thought was absolutely crazy. So number 6, Mrs. Anderson called ChiroHealthUSA Family Chiropractic and asked if they could receive her new patient, asked if they received her new patient information, x-rays and lab results. A team member confirmed the email, chusachiro@gmail.com, and that they received the information. By using Gmail, is this a possible HIPAA violation? I know a lot of offices use it, or maybe a Yahoo account or something like that. Is this a potential HIPAA violation by utilizing Gmail? Actually, it is. The privacy allows sharing information of PHI electronically or in any other format for treatment or payment purposes as long as it's reasonably safeguarded or applied. Is traditional Gmail safeguarded or Yahoo? Absolutely not. The security rule does not express or prohibit the use of email for sending electronic information. However, standards for access control, identity, and transmission security require covered entities to implement policies and procedures to restrict access to, protect the integrity of, and guard against unauthorized access to electronic PHI sent and received over email communications. A covered entity must access its use of open networks and identify the available and appropriate means to protect the information. The security rule allows it to be sent over electronic information as long as it's adequately protected. So in other words, If you don't use a secure HIPAA compliant email application, avoid including PHI in the form of email or anything. You need to encrypt those files. There are encryption procedures. You need to talk to your computer guys and your IT guys or gals to make sure that it is compliant, because literally utilizing just like a Gmail or something like that is not HIPAA compliant. Gmail itself is not HIPAA compliant. It's easy enough to get a Gmail account. I know they have like a bazillion users. So, but here are the issues. In order to make it compliant, there has to be an email provider must sign a business associate agreement. And a business associate agreement is a contract between a healthcare provider and anyone that they do business with that will have access to the protected health information. While we're talking about the BAA, it's really important that anyone walking in your office also signs a BAA. One, if you have, I know our local fire department does inspections on our fire extinguishers. They need to sign a BAA before they're allowed to come back in our patient area or anywhere checking out anything to make sure, because if they overhear something, it holds us compliant. It holds them to not say anything in that regard. So jumping back to this, email was more specifically an email server must be is a perfect example of a third party who would have the opportunity to gain access to patient information. Therefore, any email provider that wants to support healthcare institution must be willing to sign a BAA. The issue with using an out-of-the-box Gmail account is that they won't sign a BAA with you, and they will not make sure that it is compliant and encrypted in that regard. So how do you do it? You can use something called the Gmail Suite. It's very cost effective. And the Gmail Suite is a collection of the most used Google apps for businesses, including Gmail, Google Drive, Google Calendar, and it's specially tailored to make sure that it is HIPAA compliant. It gives users access to most of the things you use and you love, but then they also have it that you can upgrade it so that therefore you can go ahead and purchase it to make sure that it is all secured and all set for you. And they'll also sign a BAA with you. So let's talk about number 7. While waiting for a patient to exit the restroom to place in a treatment room, a team member from HIPAA Chiropractic accidentally overheard discussing of a patient's PHI at the front desk. Is this a violation? It's not a violation as long as they were taking reasonable precautionary steps and were discussing protected information for a real purpose. The HIPAA privacy rule is not meant to prevent healthcare providers from communicating with others and their clients during the course of treatment. These are incidental disclosures that are allowed under HIPAA. So in this case, it's really not a HIPAA violation in that regard. Number 8, a tornado or a hurricane, maybe down in Mississippi or Louisiana or wherever you're joining us, has hit your local town and you guys have been damaged. A patient has reached out to get their records as they left the area and would like to continue their care. You tell them that, hey, the clinic's really damaged and you can't get to those records. Is this a violation? Absolutely, this is a violation. You should have a disaster recovery procedure in place. The HIPAA security rule requires a policy be in place and staff members be trained in case of fire, vandalism, failure, system failure, natural disasters, or damages that contain electronic protected health information. A disaster recovery plan and procedure is required to restore any loss of data and provide records when requested in a timely fashion. Going back to this, we actually even we practice for it. So we have our fire drill, we have a lost child, we practice all this. So therefore, there's something that you guys should practice as well, and you guys document it. As Mario always says, Jimmy John's delivers. So you can always have subs delivered, and it's also a tax deduction. Talk to your accountant about that as well. But I'm just saying that it would be in your best interest in that regard to go ahead and perfect practice makes practice perfect. So therefore, it's really important that you guys have a good handle on this as well. Lucky number 9. Sally, a chiropractor at Family Chiropractic, had a long day and brought her laptop to her favorite coffee spot to work on patient notes, as she needs to get them done in 48 hours. Is this a potential violation? Well, this can be a problem. It's not that it's a violation, but it could be a problem. Do workforce members with laptops take their systems home with them out of the office? One of the leading causes of PHI data breaches is the loss of a laptop or portable media. Laptops that contain access to private healthcare information should be tracked, and only authorized workforce members should be allowed to remove them from an organization's office. Most physicians have computers they use from home to access clinical systems and gather information, but all that should be really protected and encrypted in that regard. If the computer screen is accidentally left open, or if a family member shares the computer, this is a HIPAA violation. If a home computer is used to access the information, it must be password protected with a code that only the physician knows. If the computer's laptop is transported from home to office, it also potentially is a risk. Always transport them in a hidden, out of sight, ideally locked away in the trunk, to decrease the risk of patient information being accessed or stolen and tracked. So lucky number 10. Bill loves to post and view TikTok. He works in the rehab area of Chiropractic. He loves his job and posts to his followers about his day. He's very careful not to post about patients, but he uses his office computer. Is this a potential HIPAA violation? Well, it is. HIPAA, there's been lots of reports regarding TikTok and is it secure and what information they obtain. So therefore, even Facebook has connotations that can compromise your systems. So therefore, you need to make sure that you have workstation policies and procedures to prohibit online actions such as email, social networks, stuff like that. Literally, you have to be very careful in that regard to protect your systems. We all work very, very hard. None of us want a data breach in that regard. So work with your IT people. But the HIPAA security rule states that all workforce members should be made aware of proper workstation use, implement policies and procedures specify the proper functions and the manner of which they should be performed, and physical attributes of the surrounding specific workstations or class of information can access it. So in other words, you have to have your information needs to be secured. They only should be using it for working activities, and they shouldn't be using it to post on Facebook, check their email, personal email, stuff like that, because some of that has viruses, and we don't want to compromise our systems. That might lead to a data breach. Number 11. James has been a friend of Dr. Tom since they were in the first grade. James had his vitals performed today and wanted to know his blood pressure. James texts Dr. Tom and asks him what his blood pressure was. Is this a violation? Well, we live in the era of texting, and physicians are no exceptions. Patients' information, such as texting results or vitals, signs, or symptoms, are often communicated over text. Texting often results in quicker delivery of patient care information, which seems harmless, but it means that patients' healthcare information now exits into cyberland, and hackers may have access to this information. There are encrypted programs that have come out that allow confidential information to be safely texted. However, all parties must have the system on their phones. So both you and the patient need to have it on your phones. This is an expense that many clinics are reluctant to take on, but if you're going to be texting information, you have to be very careful how you do it. Literally, this is the biggest way of literally having an issue, okay? Literally, if someone asks to borrow your cell phone and you text the patient, you've unlocked it with your face, it's a huge potential of a violation. Number 12. Krista saw Susan at your clinic when she was out walking out after getting her massage at your clinic. You go to your son's baseball game and in your small town and sit next to Krista. Krista inquires how Susan is about her lower back issues. Is this a potential risk? Breaches in social situations. Confidentiality breaches are especially common for physicians in small towns when everybody knows everybody. The average citizen is generally not aware of HIPAA laws and may innocently inquire about how things are going at church or a community event. For example, I saw Joan Smith in your office yesterday. I hope she's not having a problem with her lower back again. An instant inquiry, although responding with specific information, is a violation. So the physician's best solution is to have a rehearsed comeback phrase that I know Joan would really appreciate seeing you. Why don't you give her a call or stop by her house for a visit? So it takes the pressure off of you and puts it on them, and you're not being rude in that regard. But if you haven't rehearsed it, yeah, it can fumble a little bit and you might not know exactly what's going on. Number 13. Courtney, a team member at ChiroHealthUSA Chiropractic, has a written and signed request to fax a patient's record request to them at work. She calls the patient, verifies the name and date of birth, the fax number, and sends out the fax. Courtney calls and verifies the fax was received by the patient that requested the information. Is this a violation of HIPAA? No. Courtney did a really great job. That's what our clinic system does. You must have in place a reasonable and appropriate administrative, technical, and physical safeguards to protect the privacy of the information that's being disclosed utilizing fax. Examples of measures that are reasonable, including confirming the fax number to be used is the correct one, using a fax cover sheet that does not contain any PHI, placing the fax machine in a secure location to prevent unauthorized access. Additional safeguards could be considered when faxing highly confidential information in that regard as well. Number 14. Smith Chiropractic loves posting pictures on Facebook with their patients, especially newborn babies, after they're finishing up treatment with their treatment plan. Is this a violation? And yes, that is a real picture that I stole off of Facebook. Social media is woven into the fabric of our daily lives. However, it can cause problems for physicians who are charged with protecting patients' privacy and their information. Keep in mind that your face and your image is a protected information. So posting patients' photos is a common violation. Even if the patient's name is not shared, a Facebook, a Twitter, or a TikTok of a friend that a friend might recognize in the patient and knowing the physician's specialty is suddenly a violation. So therefore, we don't use any pictures of our patients, even when they're laying down. We actually utilize family members in that regard. We actually have them sign waivers and that we're modeling contracts when we're trying to do PR photos in that regard. So in general, do not post pictures of your patients or anyone utilizing social media. Number 15. Assuming the auto lock would be active soon, Dr. Smith at ChiroHealthUSA Sports Chiropractic did not lock his computer when he left the patient in a treatment room. While waiting, the patient got bored, like all of us, and looked at his electronic medical record. Not only did the patient see his diagnosis of lumbar facet syndrome, but he also read that his mother has breast cancer and has a prescription for Prozac. Is this a potential violation? Yes. While walking away from your computer without locking or logging off your workstation is a violation. Walking away and leaving your computer unlocked, which allows for anyone to access it, is a potential serious violation. One of the simplest things I've learned is Windows Control L. So you just hit Windows L and it locks your computer screen. So therefore, and then you have to go ahead and hit it again or Control Delete and enter your password to access it. It's just one of those things, a simple thing, and that's what I do in our clinic system and we teach our doctors. So again, what is your clinic's policy on locking computers? What is your clinic's policy for patients to request copies of the records as well? So you have that all situation figured out as well. Also, those privacy screens that we talked about earlier are also absolutely essential in that regard. Number 16. ChiroHealthUSA Chiropractic calls their patients to remind them of their appointments. And for patients who schedule well in advance, they send out postcard reminders. Is that a violation? Well, not necessarily. But the privacy rule allows patient communication, but precautions must be taken to safeguard the patient's privacy. For example, answering machine messages should be limited to the appointment time or to request that they just call it. In our clinic system, we just say, "Hi, this is Dr. Chris from Anderson Chiropractic Clinics. Please just give us a call back at your earliest convenience at 608-524-2616. The privacy rules allow for messages to be left directly on the patient's family member if there's some signed or companion if there's some signed information. Doctors are allowed to disclose information about the patient's care to the patient's family members or friends, even if the patient is not present or has no affinity, as long as the proper paperwork is signed. Again, that needs to be violated. That needs to be checked out before anything else. So also, if the patient requests confidential communications, the request must be accompanied if it's reasonable. For example, it'd be reasonable for a patient to request all mailings be sent to a specific address or to a PO box or sent in a closed envelope instead of on a postcard in that regard. Number 17. Jane Jones, who is a wealthy, well-known, and active in her community, has undergone breast augmentation surgery with a plastic surgeon. She has revealed this information to her DC before she receiving care and asked the chiropractor to keep it confidential. The DC noted this information in her charts. Several months later, another woman considering the same surgery was confiding in a chiropractic team member, CA, at the chiropractic practice. The CA told the woman, "Well, you know that Jane Jones, don't you? Why don't you give her a call? She had the same surgery last year, and she may be able to help you in that regard." Is this a violation? Clearly, the doctor-patient confidentiality is essential and enables the patient to freely share information as needed with the doctor. Doctors and people they employ are expected to protect this confidential information and only use it on behalf of the patient. This explanation of confidentiality starts when the patient relationship begins, and if it's violated, the patient may sue. Consider what would happen in a scenario like the one we described. It's very possible Mrs. Jones would have retained an attorney and possibly file a lawsuit for a breach of confidentiality against the chiropractic team member and the doctor and the employer. So everyone could be held responsible in that regard. Breaches in patient confidentiality can have a long-term adverse effect even when no lawsuit is filed. In a small town, it's all about communication verbally, and literally that's how word gets out. So if a patient loses trust in you and starts sharing that information, literally it can be really bad for your practice and hurt your practice in that regard. So a chiropractic practice cannot afford to give patient confidentiality by the short. At minimum, you have to make sure that you have defined policies and procedures in order to protect that information. Like for instance, it's recommended that you have a zero tolerance for breaches in confidentiality. Confidentiality agreement must be signed by all practices and employees, including temps upon hiring, making sure that they get the proper training in that regard. New employee orientation and training sessions should address confidentiality and train them on it. And you should reassure staff by doing in-service programming and in-service education. And that's something that you could use today's webinar for as well. And they should teach through how to disclose information, tolerances, and make sure that you have a zero tolerance of staff gossip or inappropriate discussion of that information, being sensitive about what you overhear and how do you handle phone conversations, printed information, computer screens, clinical charts, patient records received, so on and so forth. And how do you adhere to those policies and procedures, which is, again, extremely important in that regard. So if you want to know more information on HIPAA, you can contact the U.S. Department of Health and Human Services at www.hhs.gov/OCR/HIPAA. And again, it's a wonderful resource in that regard. And truly, this has been my honor and privilege to be able to speak with you today from Wisconsin. It was a really wonderful, and I had the honor and privilege. So thank you very much for letting me join you. Again, if you have any questions or concerns, please reach out. Ms. Christy and the wonderful team at ChiroHealthUSA can definitely point you in the right direction. And again, please make sure you join us and utilize ChiroHealthUSA anytime you get the chance. I know our patients absolutely love it. So from our families to yours, I just want to say God bless you all. Please stay safe out there with all the COVID things that are happening. And again, keep in mind that we're all a team. The more that we all strive together and work together and do a good faith effort to do the right thing, and not just only strengthens our offices, but what it also does to strengthen our profession. And really, that's what it's all about. So thank you very much for your time. I greatly appreciate it. God bless you all and stay safe.
Thanks, Chris. So we have 2 questions.
Sure.
And the first one is, if the health department calls and says, we have had a patient test positive for COVID-19, and they have given them our office information because they were treated here in the last few days. Now they are requesting to know who else has been in our office at the same time for contact tracing purposes.
So there has been some discussion regarding some of the HIPAA privacy and practices that have been semi-relaxed. What I would do in this case is I would contact your malpractice carrier. I am a big NCMEC guy, so I would contact NCMEC or your state association, and they would be able to help you with that. There's lots of individual state regulations and federal regulations, and so to make sure you're doing it the right way, I reach out to your state association or to NCMEC, and they'd be more than happy to help you in that regard to make sure you're doing it the right way the first time, so you don't have to worry about it in that regard.
That is awesome advice.
Thank you, darling.
Okay, our next question regarding emails and text messages. Patients have a right to receive PHI by standard email and text message. How do you recommend a chiropractor comply with the patient right under HIPAA and comply with the HIPAA privacy and security rules to protect the practice?
Well, that is an amazing question. So give yourself a high five in that regard. So what we do in our clinic system is we actually have 2 things. Number one is we have a form that our patients fill out, and we just created it that pretty much says, hey, we'd like to send you a text message of your appointment reminder, stuff like that. We keep them very, very plain. Our text messages are just saying, we don't use first names. We don't just anything. We just say that you have an appointment on Tuesday at the Anderson Chiropractic Clinics at 5 o'clock. It's better worded than that, but we keep it very simple. But we also have a form that allows us to send text messages, and they just sign it and just says like, Christopher Anderson, give access or give permission to send me text messages or send me emails at this location. But again, if they're giving you information to send it, we send everything utilizing an encryption system. So therefore, if we're sending it, let's say it's Christy@gmail.com. If we're sending it to Christy, we make sure that we go ahead and encrypt that information. So to make sure that we've done a good faith effort and we know all of our systems are encrypted on our end to make sure that we're complying with all the HIPAA security rules in that regard.
And so our ChiroHealthUSA email is actually on a Gmail server, like a lot of businesses are. So there is a way to encrypt it, but there are extra steps you have to take to ensure that you're able to do that. So just make sure to reach out to whoever's doing your IT, and they will help you and let them know, I need to be able to encrypt emails.
And literally, let me just tell you, it's super simple. The people at Google are absolutely sweet as heck. Our office, so my best friend practices in Gulfport, Mississippi, which is another Mississippi, and that's also why I love Miss Christie, because we share that. But literally, all I did is call up Google. They were super sweet. It was very cost effective to enable the G Suite, which encrypted everything. They signed a business associate agreement, and I got my best friend's clinic up and going in no time, and it was super simple. So literally reach out to your IT person, and literally if you're a little tech savvy like I am, you can go ahead and call Google, and they can help you walk through that process as well to get compliant.
See, simple, just takes like one little extra step to make sure you're doing
Yes, ma'am.
the right way. So I am super excited if anybody's in Wisconsin. They're having their chiropractic convention in person next week. And Dr. Chris Anderson is going to be one of the speakers there. So if you have the opportunity to see this amazing man live, really, you're going to regret it if you don't go sit in the front row, because you are going to have the time of your life. And I know some of you are going, yeah, I'm not having the time of my life at a state association convention. Well, it's because you're not going to the right classes with the right people. Chris Anderson's, you don't want to miss it. So definitely check it out. Again, we're going to have him back as soon as, he and I can find a date that works for us. We can't even find a date that works for us to meet up and hang out.
No, well, we are in a couple weeks though, darling. So I'm excited by that.
Weeks. Our schedules aligned, and I'm so excited about that. So he's fabulous. If you want him for a state association event or you want to request him, just let your association know. He was fabulous, and tell them to call Christy. They'll know who you're talking about. They'll reach out to me, and yes, I'll sponsor him. I would love to, because did I mention he's fabulous? So I just want to thank you all for joining us on the webinar today. What have we got going on next week? I feel like I should just know the answer to that question.
Isn't Mario talking next week, darling?
It is Mario talking next week. That's right. I forgot. Because Chris was originally scheduled for next week, and we swapped it around, because I even told Mario, I was like, I don't know if this is going to work, because, Chris is busy.
Well, Mario's busy too, but he's now retired in Arizona. So he's a little bit more time, but that man is so busy, and I've just learned so much. So literally, but yeah, next Tuesday, Mario is presenting. So, and it's preparing for the new E&M coding. So if you have not understood, there's new E&M guidelines that are going out, and they start in January. So if you have not been aware, it has all to do with timing. So if you do not know what's going on, make sure you log in next Tuesday, the 22nd at 1:15 Central to see Mario present. Because let me just tell you, it is great information, and Mario presented in a fun information. I'm a little bit more energetic than he is, but again, he is so much fun. You'll learn a ton.
Yes, we got a lot of great webinars. I mean, almost all of them are up for the year. We have I think 2 more to add for December, and then we're done for 2020.
I don't know about you, but I'm ready for 2020 to be done.
We are. Oh, and then for the handful of y'all that are still here, because I don't think I've talked about this in a hot minute.
Oh, are you talking about the challenge?
I haven't talked about the challenge in a minute. So I'm just going to say, if you haven't taken the discount challenge, what are you waiting for?
Yeah, what are you waiting for? Do you know that you can win money? I had all my team members do it. I think it's up to $11,000.
Yeah, $11,181. One lucky winner is going to get $11,181 in January. All you have to do is answer 10 questions. Every one you get right is an entry into the drawing, which means if you do it the first time and you only get 5 right, that's okay. Go in there and take it again until you get all 10 and get 10 entries into the drawing. It doesn't take but a minute, and it is fabulous. Also, if you get it wrong, it tells you your right answer. So it's a learning experience. It makes it easy for you to get them all right on the second go round.
Christy, can I volunteer to fly out wherever? You know how you went live for the Palmer student that won the scholarship? Can we go and we can make it rain, like all of us together, and they can just be dancing with $11,000? Can we do that? Because that'd be super fun.
Oh my gosh, I would love to do that. And I had big plans for Palmer, but if any of y'all saw it on Facebook, I posted this whole video about how I had these big plans. It's going to be Publishers Clearinghouse style, surprise our scholarship winner, and then nothing showed up. Nothing showed up. The big check wasn't there. There were no balloons. There was nothing. It was just me, but it ended up being really, really great. But I had a moment at one point while I'm sitting in the courtyard at Palmer going, this is going to be terrible because I have nothing. There's no excitement. However, I did remain hidden and unseen with the help of several members of the AV department from Palmer who were keeping me hidden because they were really concerned that somebody was going to recognize me, and then everybody would know that somebody at Palmer won, and then the courtyard would be full of people. So, and it was supposed to be a surprise.
Well, again, if you have not entered in, you need to. And again, tell your team members to enter in. It is great information. And again, who wouldn't want to win $11,000? So,
right?
Absolutely.
You get 5 minutes. 5 minutes of your life is all it's going to take for you to get entered to win $11,000. And if you think, well, I never win, so I'm not going to do it. Let me tell y'all, not this year's scholarship winner, but the one last year didn't enter, didn't do the scholarship application because they were like, well, I'm probably not going to get picked. And the night it was due at midnight, he started his application at 10 p.m. Central Time, and it was due at 11:59 p.m. Central Time. And out of like 300 plus applications, he was the recipient of the scholarship, which was $10,000 towards his tuition, $5,000 in cash. And the whole reason he didn't do it and just waited and procrastinated was because, well, he probably was. I'm probably not going to get it. So you never know. You got to be.
Yeah. You have to do it. If you don't play, you can't win.
That's right. So anyway, y'all have an amazing rest of your day and a fabulous week, and I will see y'all next week.
Sounds good. Love you guys. Bye. See you later, Christy.
Bye, Chris.